So, there are a couple of causes of folic acid deficiency. People who don't usually eat a lot of leafy greens or fruits tend to have a higher chance of getting folic acid deficiency. People who can't absorb folic acid properly due to chronic conditions such as celiac disease or Crohn's disease are most likely to be deficient as well. Women who are pregnant require a lot of folic acid because it is required for fetal development, so usually they take supplements to make sure they aren't deficient. As for drug usage, medications such as methotrexate, trimethoprim, sulfamethoxazole, and certain oral contraceptives can decrease the absorption of folic acid in the body. Let's take one of the causes and put them into pathology. For example, let's say the cause of this patient getting folic acid deficiency was because he has Crohn's disease. Crohn's disease damages the small intestines, and folic acid is primarily absorbed in the intestines, particularly in the jejunum. Since the jejunum is damaged, there is a high chance that folic acid won't get absorbed and won't even make it to the target cells for cell division. Going further into cell division, if we take a look at red blood cells through the process of erythropoiesis, since THF can't be made due to a deficiency of folic acid, this will impede cellular division, and this will compromise erythropoiesis to create larger red blood cells or immature red blood cells, which will decrease the amount of blood cells in the body. Additionally, if there's no THF in the target cell to promote cell division, then there will be an increase in homocysteine, which will damage the lining of the arteries, promote blood clot formation, and increase inflammation. Okay, now for the clinical manifestations. Usually, the symptoms for folic acid deficiency are fatigue, weakness, shortness of breath, and their heart rate is usually elevated. Although there are no neurological symptoms, in extreme cases, once the child is born, the child could either have anencephaly, which shows that the anterior neuropore was not closed on the 24th day, or spina bifida, which shows that the posterior neuropore was not closed on the 26th day. In terms of diagnostic testing, the appropriate blood work that needs to be done are CBC, serum folate blood tests, and homocysteine and methylmalonic acid tests. CBC identifies the anemia through the mean corpuscular volume, which will identify large cells, low amount of blood cells, and platelet count. Serum folate blood test measures how much folate is in the body, which will usually be low in this case. Homocysteine and MMA tests are used to differentiate between B12 deficiency and folic acid deficiency. In this case, it would be where homocysteines would be high and there would be normal MMA levels. All right, that's all for me. Hope you guys have a great day and take care.